In this video, we'll discuss about vitamin D deficiency. This one is very common global condition. Vitamin D is a fat soluble vitamin. Vitamin D is a fat soluble vitamin. It exists in two forms, vitamin D2, vitamin D3. Vitamin D2 is also called as ergocalciferol. Vitamin D3 is also called as cholecalciferol. So vitamin D exists in two forms, vitamin D2 and D3. D2 ergocalciferol, D3 cholecalciferol. Vitamin D is mainly stored in fat in tissue. It is stored in fat in tissue. It is required for various processes. Talk about this process in more detail. First one is it is essential for calcium homeostasis. Calcium homeostasis, then also important in bone maintenance and metabolism, and important in immune system functioning. So three important function: calcium homeostasis, bone maintenance and metabolism, immune system functioning. Next one is sources. Where do we actually getting this vitamin D? We get from dietary source, animal food product, fish and meat, fortified dietary milk. It containing very little amount of vitamin D, and also vitamin D that supplement. Animal source like fish and meat, dairy, milk, then vitamin D supplement. Then also get from endogenous synthesis, our own body synthesis. So this vitamin D derived from cholesterol in our skin. When it is exposure to sunlight, our skin exposed to sunlight, vitamin D can be derived. So that is vitamin D3. Then recommended the dietary or daily intake, how much we will take. Adult at least 600 international unit per day. In the case of elderly people more than 70 year, 800. Then less than 1 year, 12 month means 400. Next, deficiency. Deficiency is mainly caused by reduced exposure to sunlight. Mainly dark skinned individual and older individual, they also have a reduced ability to absorb vitamin D. Another category of causes, decreased endogenous synthesis because of cirrhosis, renal failure, hyperparathyroidism. In this case, kidney synthesis 1 alpha hydrolase enzyme, liver synthesis 25 hydroxylase enzyme not secreted proper. After that, third condition, reduced dietary intake, mostly elderly population. Then malabsorption. Because of malabsorption, it causes celiac disease. Celiac, this one is gluten rich food, that means wheat, barley we will take means not absorbed because of malabsorptions. Then corn diseases. Then chronic pancreatic insufficiency, cystic fibrosis, Crohn disease. These are the condition malabsorption will happen. Other factors like medication like spirolactone, rifampin, phenobarbital, carbazepine. These are the drugs will causes. So these actually decreases that activity of enzyme in liver. Enzyme was secreted 25 hydroxylase enzyme decreases. So decrease activity of 25 hydroxylase enzyme, it will cause us vitamin D deficiency. Last factor is genetic condition of hereditary vitamin D resistant, we call rickets. So in this video we discussed the vitamin D deficiency. Vitamin D is the fat soluble vitamin. It excited in two form, and then it will stored in fat in tissue. It will stored in tissue in the form of fat. Then sources, then recommended dietary allowance. Deficiency, then decreased endogenous synthesis, reduced dietary intake, malabsorption, medication, and genetic factors. So individuals at high risk of vitamin D deficiency are elderly people, overweight, and are obese patient. Thanks for watching.